Heel pain in children is not normal, but it can be treated. Hello, I'm Dr. Brant Gibson, and I would like to talk to you about a condition called Calcaneal Apophysitis or Seaver's disease. This is an inflammation of the growth plate that happens in children. In girls, it's between 9 and 14. In boys, it's between 11 and 16. It's the Achilles tendon that attaches to the back of the calcaneus. It's pulling on that growth plate. The growth plate gets inflamed, painful, and tender. It used to only happen in soccer players. Now it happens in all sports: soccer players, football players, basketball players, baseball players. We're seeing it in gymnastics. We're seeing it in dance because that growth plate gets inflamed and it gets pretty tender. So let me show it to you. Let me kind of explain it to you a little bit more. So the normal presentation of a growth plate is really, really smooth. You can see how smooth that growth plate is right there, or how smooth that growth plate is right there. That's the way a growth plate should look if it's healing, if it's growing the way it's supposed to, and there's no stress on it. The problem is you can sometimes get a pretty inflamed and pretty tender growth plate. If you look at this one, you can see how rough that edge is. The roughness of that growth plate is consistent with Calcaneal Apophysitis because the Achilles tendon attaches back here. It's pulling this direction whenever they run or walk. And because of that, it's pulling on that part of the growth plate right in the middle, causes this side to be rough and causes the other side to start getting calcified. And you'll see little breaks, little lines in there that are consistent with the cracks in that bone area, consistent, saying that the growth plate is being pulled on quite a bit. Again, you can see a pretty good crack there, pretty good crack there. Some people will read it as fractures. They're not. They're consistent with Calcaneal Apophysitis. So if your child has heel pain or even ankle pain, where they're limping after running or after playing their sport, then the best way to treat it is one of two things. You can do a heel cup, which is a hard plastic cup that cups their heel, keeps the Achilles tendon from pulling on that area, and pulls the fat pad back underneath the padded. Or you can put them into a custom orthotic that takes it to the next step and puts them into a more neutral position, helps the foot function the way it's supposed to. If your child has heel pain or ankle pain when they play activities, they can stay active if we put them in either heel cup or custom orthotics. Let's keep them active. This is Dr. Brant Gibson. Have a great rest of your day.